Hi, I'm Joel Bloom, president of New Jersey Institute of Technology. At NJIT, we believe that not only our students, but all citizens need to be informed about the issues facing higher education. As New Jersey's Science and Technology University, NJIT is proud to support the important programming produced by the Caucus Educational Corporation and their partners in public television.
Women's Heart Health next on Caucus, New Jersey.
Funding for this edition of Caucus, New Jersey has been provided by TD Bank, PSE&G, committed to improving New Jersey's economy and strengthening its communities. NJIT, New Jersey Institute of Technology. Horizon Blue Cross Blue Shield of New Jersey. Johnson & Johnson. New Jersey Sharing Network, dedicated to saving lives through organ and tissue donation. And by Adler Aphasia Center, helping stroke and brain injury survivors recover their speech.
Welcome to Caucus, New Jersey. I'm Steve Adubato. You know, cardiac disease is the #1 killer of women in the United States of America, and many women believe that it's simply a man's disease. Don't buy it. More women have heart-related events than men. Here to discuss the way that women can improve their heart health, we have Michelle Scullion, who is recovering from a cardiac event and is a patient of a doctor you're about to meet. Dr. Talya Spivack is director of women's cardiology at Virtua. Dr. Jacqueline Hollywood is a spokesperson at the American Heart Association. And finally, Debra Brown-Grossman is a registered dietitian. Good to see all of you.
Thank you.
You know, it's interesting. Is it a fact that a lot of women believe it is a man's disease? Now, my father's father died of a heart attack at 44. My father's brother died at 58 of a heart attack. My father had a lot of heart issues, a lot of issues, right? And he says, that's an issue in our family. But the women never had any problems. So I grew up thinking, yeah, I better take care of myself. It's a man's disease. Am I wrong?
Yeah, that's a very definite misconception. So actually, as many,
well, they all smoked and overate, but that's another story.
You know, there are some things you can change, like your risk factors like smoking and diet, but there's some things you can't change, and one of those is family history. And a lot of people believe that cardiovascular disease is a man's disease, like you said, but actually, I think Dr. Hollywood would attest to this as well, more women die of cardiovascular disease every year than men. And so it's really important
most
for them to
don't know
know.
that.
No, and interestingly enough, we've had tremendous advances in medicine, technology, stents, but every year since 1984, more women than men have died of heart disease.
Is it getting worse? Meaning, are the numbers getting worse for women?
We've made some progress over the past year since the Go Red for Women campaign was invented.
With the American Heart Association.
From the American Heart Association. In particular with minority and with young women, they're still unaware of heart disease as the #1 killer. They still fear breast cancer. But heart disease kills 10 times as many women every single year compared to breast cancer.
Why do you think it is that there's so much attention paid to, again, breast cancer is still an important issue we need to continue to focus on, and here at Public Broadcasting and Caucus Educational Corporation, we've done a lot, we'll do more. But why do you think that this issue of cardiac related issues for women continues to be, and you've dealt with this personally, this isn't some academic or philosophical issue for you, you dealt with this personally. I mean, you're a patient. Why do you think for so many, and for you in particular, because if I'm not mistaken, you weren't convinced, even while you were having symptoms, that they were real and did not react right away.
That's true.
So first the philosophical question, then the question for you. Why do you think so many women are like, not me?
I just think from my own self, I've heard more about breast cancer and, you know, received more education around that than I ever did in regards to, you know, heart disease. And heart disease does run in my family on both sides.
Break it down without being too personal.
My grandmother has had, both grandmothers have had angioplasts, and they lived into their 90s. My one grandmother is still alive, but you know, there has been heart disease in our family, and on both sides, men and women.
And you knew it.
And I knew it. I just didn't think at my age, at 47, that that would be any issue at this point. So the event, I had a pretty rough morning, just normal, typical day where there's a lot of stress and anxiety trying to get out the door and get my son out the door. And I got a little upset, and I remember getting in the car and turning the key, and I felt this pain in the center of my chest. And I just attributed it to, you know, gas or, you know, just anxiety, whatever. And I went on with the day. And actually, I went on for 3 days with this pain.
3 days? Mm-hmm. With the pain?
With pain.
That did not subside?
On and off. It would, you know, come in droves, and it would be, you know, pretty intense, and then it would pass again. And
Who did you tell about it?
I really didn't talk about it. I did tell one of my coworkers. She begged me to go to Marlton Hospital, which was right across the way from where our office is. And I said, no, I'll be okay, I'll be okay. And I did take, I took an antacid, trying to get it to pass, and then really wanting to believe that the pain was subsiding. You know, we went out as a family on a Friday night. We had dinner. We did some shopping. I was going on vacation in a week.
You were having a cardiac event the whole time.
Mm-hmm.
Third day, what happens?
Third day, Friday, it was actually Saturday morning at 4 a.m. I woke up in unbelievable pain, and I went downstairs to get more Tums. And my husband woke up, and he said, "What are you doing?" And I said, "I'm just in so much pain." And he said, "What time is it?" And I told him the time. And he's a volunteer EMT, and he said, "You know, this is the witching hour," meaning that this is when the calls come in. He said, "I need to call 911." And I said, "No, please, don't do it. I'll be okay." And then I actually started to cry because the pain was just so intense. He woke up our son, he put me in the car, and we drove to the hospital. And while we were en route, we were thinking about which hospital to go to. And I said, you know, my coworker kept saying, "Go to Marlton, go to Marlton. I think we should go to Marlton." And we were tempted to go to our Voorhees hospital. It's a newer, you know, very, very lovely hospital, and so is Marlton. But I just said, I think we need to go to Marlton. And thank God we did, because within 5 minutes of being there, I literally walked back into the ER area, sat on the bed, and when they tried to do the EKG, I was withering in pain. I could not stay still, and I was having a heart attack.
What time do you enter into this? How do you enter this?
So the interesting thing is that Michelle literally got in at the exact moment she needed to get into, because Michelle had a cardiac arrest about a moment later. Yes, at Virtua, which means that her heart stopped beating normally, and it went into rhythm that's really not compatible with life.
Was it a serious situation?
Absolutely. If this was something that had happened at home, this is something that some people don't survive.
She didn't use an ambulance. Was that the mistake?
Yes.
Okay.
So we definitely recommend that if anybody has symptoms like Michelle is using, you know, you don't want to you don't want to drive yourself in. You don't want to take risks, because you can have a cardiac event like that.
And you need the medical attention en route.
Yes.
Just to be clear, keep going.
And she did the absolute right thing, because she went to our hospital that has a cardiac catheterization laboratory. So they were able to get her right in there, stent open the vessel in her heart that had closed off. It was 100% blocked.
Because it wasn't pumping. Nothing was pumping.
Exactly. And she even had to receive defibrillations, which are shocks to the heart, to get her back to a normal rhythm. So, you know, she didn't get in a minute too soon. It was perfect that she got in when she did.
Real quick before I get everybody else in. The 3 days.
Yeah.
What's your reaction?
Well, you know, it sounds surprising,
It's typical?
but unfortunately,
I was
it's
praying that it was atypical.
You know, with women especially, I'm just gonna say with women are so busy holding down the fort, doing everything else, that they really don't tend to prioritize the symptoms they feel. And there's this denial, this brushing off. I couldn't be having this happen to me.
With the pain?
Absolutely.
Deborah, what are you hearing? I mean, we'll do the nutrition thing in a second, but come on, I see you with a face of shock.
I'm surprised since I don't get, this end of it.
You get after the fact.
Or before.
Or before to try to prevent. Go ahead.
It's shocking to me that it took so long, and that your husband was EMT and he didn't put you in an ambulance sooner.
We're not blaming your husband at all. I'm going to defend husbands right now.
But this is the funny thing is, and I think you'll probably attest to this too, like so many of my male patients come in because their wife is saying to them, like, you're not breathing right, something's not right, you got to go in.
The women will do it for the men.
The women bring the men in. The men don't always bring the women in.
No, but this is actually a very real phenomenon. The American Heart Association did phone surveys with 2 scenarios, giving a scenario where the patient was their husband or a man in their life and what they would do, and the scenario when it was themselves. And unanimously, they all said they would take them to the emergency room and get immediate attention. But when it was themselves that were having similar symptoms, the majority of them did not say that. They said they had to go to soccer, they had to go to do the laundry, they had to go to work.
I got to go to soccer.
Maybe they would make an appointment to see a doctor in a few days. So women really put themselves a little low on the priority list, and that's a real problem. And that's one of the things that we're trying to bring awareness to, because these delays in treatments lead to poor outcomes and actually increase mortality rates.
Let's do this. Let's do a couple things. Let's talk about prevention first, and then we'll talk after the fact. Okay. And symptoms. Let's do symptoms first.
Sure.
Symptoms. Is being nauseous a symptom?
Absolutely.
Okay, are there different symptoms for men? Because every time I start get tingling, I get tingling down the left arm, I'm like, let's go. I'm immediately in the emergency room, and every time, luckily, I'm knocking on wood, the doctor's like, well, you got anxiety. Get out of here. Every time, because you got issues, but they're not in your heart. Right. I go, let me tell you about my family history. He goes, just get out of here. That's not the issue. Every time with the tingling. That's not necessarily always that's for women, right?
So men and women do have some similar symptoms.
What's
so
similar,
the
what's not?
Kind of classic heart attack symptoms that we talk about, like chest pressure, which a lot of people think it's got to be a severe pain. Pressure is actually a really distinct symptom. Shortness of breath when people are trying to exert themselves or do activities. These are kind of the classic heart attack symptoms that we tell people to look out for. But women also have atypical symptoms.
Such as?
Such as women have pain that radiates to their jaw. So some women will have pain in the jaw, kind of blow it off and be like, maybe I have a toothache.
One side or the other?
Could be, no, it could be any side of the jaw.
Jaw, shoulders,
shoulder,
neck,
back, everywhere. Yeah.
And the GI symptoms are very, very
classic.
common and very often send women down the wrong path. They think they have a virus or a bug, and that also delays treatment because they don't think it has anything to do with their heart. Similar to you were taking Tums, thinking it was your stomach.
Exactly.
And there's something you said that I think really resonates too, is one thing Michelle told me is one reason she didn't want to go to the emergency room earlier is she didn't want people to think she was being a hypochondriac and anxious.
Oh, I don't
and that's
care.
something, but this is the thing, this is something that women worry about. There's this this stigma, exactly. I don't want to bother anyone. I don't want to be a burden.
You actually were concerned that people were thinking, like, what's up with you?
Yeah, I did not want to be diagnosed with anxiety. I was like, it's not, I know I'm anxious. I'm always anxious. I'm always doing stuff. So it must be that.
But what about if you're right?
What about?
Time is muscle.
Yeah.
You need to get
Time is muscle. Translate that.
Time is muscle. The sooner you get yourself to the emergency room, the longer you're going to live and the quicker that we can open up that vessel. And if it turns out that it's nothing, it's great, you go home. But we'd rather you be in the right place at the right time.
Can we talk risk factors? Risk factors for women. Family history?
Family history.
Weight?
Yes.
So now jump in.
Diabetes.
Well, I want to talk about diabetes because that is in the news, and people are the single most reason people come and see me, either before or after some cardiac event, is because they have diabetes. I'm a certified diabetes educator, CDE, as well as a dietitian.
Right.
And so and they're more focused, and we've seen this on, getting the blood sugars down. And there just doesn't seem to be any awareness at all of, the connect between diabetes and heart disease.
Well, let's clarify it. Having diabetes.
And much riskier for women diabetes.
Let's clarify. For women
have
with
3 times
diabetes,
the
is it a
risk.
fact that it potentially triples your likelihood of having a cardiac
If
event?
you have
Is that
type 2 diabetes, you have 3 times.
type 2?
Yeah.
Type
Or
2
type
diabetes
1,
or type
probably.
1?
Yeah.
It triples the likelihood of having a cardiac event?
To a woman without diabetes.
Is that a fact, doctor?
Yeah.
And most women don't know that. So if a woman has diabetes, what should she do? Right now, she's watching right now, she has diabetes. She should do what?
Get a cardiologist as well.
I think it's all about, like I said, there are some things you can change, there are some things you can't change. Your risk factors, for the most part, are modifiable aside from genetics, family history. So if you are a smoker, get yourself
Smoking
in,
right
quit
now
smoking.
does what as it relates to your likelihood of having a cardiac event if you're a woman?
Greatly increases it.
Greatly?
And it actually looks like it increases it more for
than a
women
man.
than it does for men.
Why?
No one knows, sure.
It's a great question
Yeah.
and incompletely understood because the majority of all the clinical trials and all the data we have were all done in men.
Yes.
Because listen, the medical community, this is fascinating, tests and does research more with men because the perception is it's a man's disease, so therefore we research more with men, so we know more about men.
Most of the clinical trials have less than 20% women and even less, significantly less minority women. So we really have a call to action.
But women are having more of the cardiac events.
to get involved in clinical trials.
You did not smoke?
No, well, I used to. I quit over 10 years ago.
Okay. Let me ask you this, since the event, because by the way, you get exercise matters, exercise, smoking, trying to reduce your stress.
Diet.
Yeah, right? You reducing your stress at all?
I'm reading about it. Trying.
Hold on, wait a minute. I'm curious. What are you reading? What,
Just
Deepak
different-
Chopra? Like,
no,
what are you reading?
Just different books
By the way,
about
poor PBS, we love Deepak Chopra.
managing different books about managing stress, just deep breathing techniques.
You doing yoga?
I do yoga.
Oh, great.
I do. My biggest challenge in exercise is really the time and the commitment. And even though such a tragic event occurred and, I was given a second chance, I still find it difficult to really incorporate that into my life. And
The diet part?
the diet part as well,
Talk about
yes. Well,
Have you changed the way you cook and what you eat?
we attempt to, but as life gets busy again and, I'm involved in going to sporting events and, just working full time, getting home, trying to, get a meal on the table, but we're rushing out to get, my son out to, practice or whatever. It's more and more difficult, and we wind up just going out for a restaurant, which is so high in
Devil's
salt.
advocate. Very high in salt. Sorry for interrupting. Devil's advocate.
okay.
I hear you. And I'm never one when it comes to a mom who's trying to keep it together, or a dad, but mostly moms, because you wind up disproportionately having more responsibility. But given the event that you had, and that how serious you said it was, because you were treating her, that hasn't caused you and everyone in your family to say, time out. We've got to totally rethink this whole thing.
It has. I think it's also a matter of changing, behaviors. My husband can only go so far with asking me, to go. He bugs me probably at least 10 times a week. Did you go? Did you work out? Did you work out?
So he's trying to help.
Oh, he does. He does. He likes to shop, go grocery shopping.
He's trying to help.
Yeah, he does. He does try to help. But, again, it's behavior modification, and it's, quite a bit of a challenge.
You think you need an intervention?
I do. I would rather be watching.
I think Michelle's being a little hard on herself because as someone who's treated her, after her event, we have a lot of services at Virtua to help people, particularly women, because we have a special program geared to women to help with things like this. And one thing we got her enrolled in immediately is something that we call cardiac rehab. And Michelle has actually completed about 18 weeks of this. So she's being a little hard on herself, but she has been getting out there and doing it. And in her defense, that's something that I hear all the time is, doc, I can't find the time to exercise. And the way we kind of respond to this is, yes, we have recommended amounts of exercise that we do say everyone does, but it doesn't have to be all at the same time. So what you could do is we recommend about 30 minutes of moderate activity a day. So you wake up in the morning, you go for a 10-minute walk around the block. You eat lunch, you go for a 10-minute walk around. Exactly. You get home, you get out of the car.
It adds up to 30.
Exactly, and that counts. So anything that anyone could do.
What about the nutrition part? Help out.
Well, yeah.
It is hard to pull it all together.
It's very
Come
hard,
on.
and mostly the problem is the environment, this obesogenic environment that we live in.
I've never heard 20 years plus of doing this show, obesogenic.
Well, that's what I call it. It's just that we know that people tend to eat what is the food that is readily, in any culture.
Yep.
The food that's readily available, that's not expensive.
It doesn't take a long time to cook.
And what everybody else is eating.
Right.
Okay.
She's trying to get it together with the kid, with practice.
And
give her advice.
that's the problem in this country, is that it's very difficult. The U.S. food supply and what's available at a cheaper price is probably
But that's a policy, philosophical,
chemically modified food.
I get that. But there are a lot of other women who are in a position like you. If we're trying to give practical advice as to how to practically eat healthier, what do we say? Seriously.
Well,
Go to Whole Foods. I don't mean the store. I mean Whole Foods in general. Lean proteins, fruits, and vegetables.
And that's what we
Getting away
do.
from the package, the box, the bags.
Well, that's what I was
do.
saying.
That's what we
Chemically
should.
You do that.
Yes, we do. We definitely have vegetables and fruits, and we have chicken, fish, and we do our best to eat that. But in reality, that might be 2-3 times a week,
Right.
and the other
then you
4
go pick
are
up
out for
foods
dinner, or something that's
picking up?
quick and not as healthy. And and as far as like when I bring my son to to his practices and so forth, I do bring a pair of sneakers and I walk a track.
Oh,
and
you do?
I do, and I do it at work. We have great events through work where we have a walk challenge where you actually plug in your numbers. I am trying, but when you think about the event that had occurred, that I actually, I died. I mean, maybe a minute, but still, it happened. I was 100% blocked. To come to the other, side of things and still find it challenging to eat right and incorporate exercise is really eye-opening.
It makes you a human being.
It
Life
does.
gets in the way.
It does.
It makes you very real, and I have a feeling there are an awful lot of women right now who are relating to what you're saying. It's so easy for people to criticize and say, why don't you do this, why don't you do that?
Correct.
They're not living in your shoes right now.
No.
And we wish you nothing but the best, and I know you're trying, and you're going to keep trying harder. Any other advice in the few minutes we have? Go ahead, I'm sorry.
I think that's the struggle with many women in terms of even just reducing their risk. It's trying to manage all of this. They're working, they're taking care of their kids, they're taking care of their house, and some things fall through the cracks, and it's usually their own health.
It is. And I often talk to my wife about this. Both of us try to exercise on a regular basis, but it's much easier for me to get to the gym with a very busy work schedule. But I'll get to the gym, I'll do what I have to do, and I'll say, we'll have a conversation, and I'll say, hey, how was your workout? And she'll say, did you forget about the 3 kids here and all the things she had to do? And I'll say, oh, you mean you didn't get the workout today? And her whole day will be affected by that. And my point I'm making is that I forget how much harder it is for her to get that workout in than it is for those of us who are guys who have busy work schedules, but we don't have the same demands in terms of all the other things that go on. And I don't think sometimes we appreciate that. So it's very stressful. I don't think we appreciate how stressful it is for women.
Yeah, and
Which has a direct effect on the heart, no?
Yeah, well,
connection, stress and heart.
we definitely believe in mindful medicine, and again, at Virtua we have programs in place for this exact reason, because we've found that stress reduction is going to help to hopefully reduce future cardiac events. We actually have programs in place to teach people mindful meditation, things like that. Yoga, we actually did talk about yoga at one of Michelle's visits to help her try and reduce her stress levels. But, just to be fair, Michelle's doing a great job. She's being a little hard on herself, but she's doing a great job.
In the time we have left, any other concrete advice for women watching right now?
Yes, I mean, there are a lot of great websites people can access. I want to get that in.
Real quick.
if you want to find a registered dietitian, you can go to eatright.org.
Eatright.org, a nonprofit. We like that.
Yeah, it's the American Academy of Nutrition and Dietetics.
Yep, I got it.
The American Heart Association has
Go
a
ahead.
nutrition center, which has a lot of wonderful information, recipes, cooking instructions.
Good, I said one. You got 7. But that's good. Quick advice.
80% of this is preventable. Simple things you can do in life: eat healthy, don't smoke, and try and exercise.
Love it. Advice for your colleagues out there watching, all the women.
Oh, call 911, really. Because honestly, we were very fortunate that we went to the right hospital. If your hospital doesn't have a catheterization lab, then they would have to transport you somewhere else, and time really is of the essence. So.
You're fortunate you found her, right?
I am, very.
Yeah. I want to thank all of you. You've done a great public service, particularly you for being so open about your situation. We wish you nothing but the best.
Thank you.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by TD Bank, PSE&G, NJIT, Horizon Blue Cross Blue Shield of New Jersey, Johnson & Johnson, New Jersey Sharing Network, and by Adler Aphasia Center. Promotional support provided by NJ.com, Small News, Big News, True Jersey, and by NJ Biz, All Business, All New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.
I think at NJIT there are a lot of smart students.
I came to NJIT for mechanical engineering because with in-state, it's one of probably the top 3 schools for engineering.
It sort of creates a friendly competition where you can learn from them.
It's a great academic school.
I feel I'm being challenged, but at the same time, I love the classes I'm taking.
The atmosphere of being here is like being at an upstart company. It's that same kind of drive, that same kind of passion.